Here is the thing, healthcare in America is a very, very complex ecosystem. In many ways, it's very broken. The biggest benefit I got from mentors, they made me see things from different perspectives that I was blind to. I wanted to go somewhere where there's a big problem that is actually hurting people. And is there a way I could make them feel better when they're at their most vulnerable? And that was healthcare. I was at Disney for a long time. I immensely enjoyed what I did. The thing that I really loved at Disney was this.
Hi Tilak, welcome to the Humanware.
Thanks, Millie. Thanks for having me.
Let's start with your experience in Disney and CVS. What do you see in common in all those companies in our world? What they did right?
Putting the consumer at the center, that's the secret to success for Disney and to CVS. If you take care of the family or the person that goes to a Disney park, gets on a Disney ship, or go to a Disney film, if you take care of their need and always focus on the purpose of making them happy at Disney, and the same thing at CVS, always keep the patient, the consumer at the center and making them healthy. That's the purpose. Then you win, and that's how I think both companies have been very successful.
Can you bring us back of the original story of CVS? Start from the very beginning.
It started out as a consumer value store. That's how it all started, putting consumer at the center and being a value provider for the consumer. But look, it started out as a pharmacy, and then the company grew to provide other parts of healthcare. So we kind of, over the years, collected the services that the patients want. And I want to make one point here. Most consumers want a completely integrated healthcare experience. The best way I could see to provide that integrated healthcare experience is to have all these assets together in one company. That's the best way to do it, and that's what we have done, and consumers appreciate it.
You know, when we see some very successful business story, it's never just start overnight. There will be few very important key milestones. So what are the key milestones for CVS to become the CVS today?
I think, look, I'm gonna give you an answer that's gonna sound corny, but I don't mean to. Every day is a milestone for CVS. 185 million Americans are touched by CVS every year. So 1 in 3 Americans. So every time a customer walks into a CVS store, every time they walk into an Oak Street clinic, every time they use our app, that's a milestone. We want to do better. So, but along the way, collecting these assets to provide an integrated service has been the secret to succeeding.
And you used to work in Disneyland for a very high position and design the customer experience in the digital space. And then you now working for CVS. And you also extremely important role as a chief executive level. So where did you see the same similarities and difference between the two companies?
So Disney, the division I worked for, is the division, perhaps the largest division of the company. Everything that's not television or movies. So all the Disney theme parks around the world, all the cruise ships, all the retail stores and e-commerce for merchandise, all of that and other experiences like National Geographic, and all of that is part of the division I work for. Here is the thing, we have done incredible things. We built Shanghai Park from nothing, dirt. Magic Bands in Disney World was a huge hit, and so on and so forth. We built Star Wars Land from scratch. The thing that I really loved at Disney was this. We created a product, we put a lot of effort into it, and then we would launch it. And the same day, we will get feedback
Oh,
from the little girls and little boys and big girls and big boys that walk around the park. We wouldn't know. Did they like it? Did they enjoy it? Did we put a smile on their face? And I loved it. There is, that's what we live for. That's what we do the work that we did for. Same is the case with CVS, right? Where we do a lot of work, whether that is digital experience, physical experience in the store, um, AI-powered experiences, all those things. We do that, we come up with the ideas, we put it out there, and we know immediately the consumers liking it or not. Do we need to do something different or not? And that's a huge gift, having that feedback loop, and that makes us better and better as we go.
when you working for the CVS at the very beginning, did you feel a big cultural difference from like the two companies? And what do you think in CVS like they do good? So other like companies out there we can learn from.
Not just CVS. Healthcare in America is a very, very complex ecosystem, and in many ways, Elaine, it's very broken. There are five things the way I think of it, there are five things that are really broken in American healthcare system. The first, there are just a large number of stakeholders: hospitals, insurance companies, drug benefit companies, doctors, and drug manufacturers, and just lots and lots of stakeholders. So it makes the entire ecosystem very complex. Number two, the relationships between those stakeholders, I can't think of a better word than say it's adversarial. They all hate each other. All these stakeholders, and their job is to serve the patient, so the consumer, they don't like each other. It's adversarial. And number three, the unit cost of care is very high. So a specialist service is very expensive. A hospital stay is very expensive. Drugs are priced very high compared to the rest of the world in America. So that unit cost of care is very expensive. And number four, access to care is hard to get. We have the worst shortage of doctors and clinicians in America. Compared to the population we have and the number of people that are aging, we don't have enough doctors and enough nurse practitioners. So you can get access to care. And last but not least, because of all these reasons, consumers just give up. They don't engage with their own health. So what happens? Well, something that could be prevented is not prevented. Something that should be managed as a chronic condition becomes very acute. So there's a lot of big things that are broken. Now, you asked me a very simple question, which is coming from Disney to CVS. Both are incredible companies. Both are American icons, and both have a strong purpose of, on the Disney side, putting a smile on a kid's face, on CVS side, making somebody healthier. So the purpose, so in that regard, both companies are very similar. At Disney, if we create a great product, we won. Healthcare is not like that in America. It's a very complex because of all the issues we talked about. So it's a much more complex and a bigger problem to solve.
But as far as I know, CVS owns the insurance companies, and you guys became the pharmacy beneficial manager. So I think for many people outside of United States, actually we don't really understand what is pharmacy benefit manager do and what is the role of CVS in this whole entire ecosystem.
Bringing all those, the medical insurance, pharmacy benefits manager, primary care, episodic care and minute clinics, and the pharmacy, bringing all of that together is actually the step towards making healthcare better, right, for the consumer. In America, as I said, and when we were talking about some of the issues, drug prices are very high. Pharmaceutical companies set the drug prices very, very high in the US compared to Europe or Asia. Same drug sometimes costs anywhere between 6 to 10 times what it would in the US than what it would cost in Asia or Europe. So the pharmacy benefit manager's role is use their ability and buying power to reduce those prices for the consumer. In a free market environment, which is what in the US, the pharmacy benefit manager is working on behalf of the consumer to negotiate a lower price for the drugs with the pharmaceutical company. So that's why it's an incredibly important function. Without that, consumers won't be able to afford the drugs.
But did you see a difference from, let's say, past 30 years to now? What are the difference the technology have a role to play in this new world of medicine?
Well, I have to tell you a story. In 1970s, 80s, India, which is where I was born, we were not a connected society because the copper lines for telecommunications too expensive. So we didn't have good telephone system. Whereas in America, it was a highly connected system with the hardwired phones. Then a new technology came called cellular. And then suddenly that technology changed the world, especially in the third world. India became highly connected because of cellular. Historically, in America, healthcare has been very slow to adopt technology. And even when they adopted technology, it did not yield the right type of results. AI, on the other hand, I think is the cellular type technology for healthcare. It is the leapfrog moment for healthcare. So, look, there is a lot of hype about AI. The technology life cycle. There is a hype cycle, and then there is a, oh my God, it's not doing anything. I think AI is somewhere on that lower trajectory. Everybody got very hyped, and then they go, oh, we are not getting the results we want to get. The reality is somewhere in between, and we're going to get to that steady state. I am a big believer AI is going to change the world. But if you look at what are the things that we know for certain AI is going to do for healthcare, zero doubt. I think AI is going to reduce the administrative work involved in healthcare. All these stakeholders exchanging paper, negotiating. 30% of healthcare expense is in that administrative expense. I think we can reduce that in a material way with AI. Second, I think AI is going to augment doctors. We don't have enough doctors. So I think AI can augment doctors so that people can get much better access to care. I think AI would significantly accelerate the discovery of new molecules
Yes.
and new drugs. These things are a given. I think it's going to happen, and that's very exciting.
Congratulations on your new project of Health 100. Could you tell us what is CVS bigger picture for the world of AI and how the Health 100 will going to help us to living a more holistic life?
So, earlier when we were talking about Malene, I talked about too many stakeholders in healthcare. Consumer is confused. Unit cost of care is too high. It's an adversarial relationship. You can't get access to care. And because of all of that, consumers don't engage in their own health. There is a saying, I don't know if you heard this in America. In America, people don't think about their health at all until that's all they think about because they're sick, right? So don't think about it, don't do anything about it. Boom, you are really acutely ill, and that's all you think about. We want to change that. We want to change that behavior to people proactively engage in their own health so that they can live a healthier life and longer life. That's what Health 100 initiative is supposed to address. Because of Health 100 platform, we believe consumers would start engaging in their everything about their health and their care much more actively and proactively, because we are putting everything they need to do for health and care in one place. Plus, there is every consumer on Health 100 is going to get a dedicated AI assistant for themselves. And that AI assistant proactively is going to do all the healthcare homework for them. And the AI assistant is also going to say, hey, Meline, it's time for your lunch. Hey, Meline, you missed the drug. You got to go back. Hey, by the time it's time for you to go for a follow-up visit. And it will set up your visit. It will order your drug. So that is the ecosystem we are creating, where it's a destination of choice, a front door to everything health and care, and the consumer don't have to do most of that work. When we finally launch Health 100, which is going to happen in 2026, there are many components to Health 100 platform, but I want to focus on there is an app, okay? A consumer would download the app, they will create an account on the app. At that point, they will tell us, hey, this is my primary care doctor, this is my insurance company, this is my pharmacy benefits company, and this is my favorite pharmacy. They just tell us. We, the platform, automatically creates all the connections. And we go get all the consumers' health records from everybody, all their doctors, and without consumer doing anything, all they do is give us consent. We go get all their data, create a complete health record for that consumer. Then we start this AI agent I talked to you about, and that AI agent, using that health record, will then be constantly with you. It's an always-on agent to do anything and everything that the consumer needs to do with their health and care. We also will have, for the lack of a better word, I'll call it digital async care. So think of this as you wake up in the morning, you have a pink eye, right? So you just you say Health 100, hey, my AI agent, I have a pink eye. And the AI agent will have a chat with you. Does it hurt? Does it sound like you have sand in your eye? Are you having a lot of teared eyes? Using AI, we determine what may be the issue. Okay. And then if we determine you have pink eye and you need to get an antibiotic, or there is a doctor completely async, that means you don't have to see the doctor. We send the AI collected information to that doctor. That doctor prescribes what you need to have. So before you finish that conversation, your script is in the pharmacy. And you can say, I don't feel like driving, I have pink eye, can you just deliver that script? That script shows up before you finish the call.
That is very convenient compared with nowadays. Now, I don't know how it is in US, but in UK, very likely you need to see specialist and you need to navigating the insurance system as well. I just feel like many problem getting bigger during this
A
time.
wave time.
Yeah.
That's right. That's what we want to solve. So the agent, as you're telling the agent what's wrong, and the agent sets up the doctor to send you the script, etc. We also check the insurance because we know who your insurance company is. We also tell you exactly how much it's going to cost. One of the things that in America people hate about healthcare is often they don't know how much it's going to cost. A bill comes 2 months later and they go, what? Uh, we not only tell them what it's going to cost, we also suggest, hey, if you do this or you go here to this facility, your out-of-pocket cost would be cheaper. Knowing what's going to cost is one thing, and then being presented with options, then they can decide on to minimize their out-of-pocket cost is huge. And that's what Health 100 is supposed to do.
I really love how this sounds like. As a consumer, I feel many times I'm lack of knowledge, and also when it's come to health, there has a lot of fear involved. So if it's an AI system, it will reduce my shame of sometimes being sick or being vulnerable. At the same time, it gives me solutions of the medicine or doctor to see.
And you actually hit on something that's very important about Health 100, which is you can go chat anywhere, right? That's not the point. The point is, does your chat about your health, does it translate into an action, a solution to the problem you have? That's the most important thing. And that's what Health 100 does. It takes from chatting to action to a script to scheduling a doctor's visit. All of that happens as you talk to the AI platform.
Where do you see the CVS approach is different from everybody else in the market? And how important is this experience as a consumer for this digital designs? Like, I believe it's probably different with if people go to the store, right?
Look, I think what is really, really important is to give people choice. There are people that are completely comfortable pulling up the app and doing an AI chat. They love it. They want to do it. That's how they want to communicate with a doctor or what have you. But we know there are plenty of people that would rather call, right? Don't want to do the app. That's okay. Part of the Health 100 platform is conversational AI. So if you call, there is a AI agent that just speaks to them as if it's a human being. And if the question becomes too complex for an AI agent, there's an immediate availability of a human, a person to speak with. That's part of the platform. Same is the case with some people actually want to walk into the store. Pharmacists, by far, are the second most trusted healthcare providers in America, next only to primary care provider. So there's doctors, very well trusted, and then next is pharmacist. We have 30,000 pharmacists in our stores. And they are, for majority of the Americans, they're about probably 5 to 10 minutes away from a CVS pharmacy. So there are a lot of people that actually want to walk into the store and have a conversation with the pharmacist. So the Health 100 platform enables the pharmacist to know what the consumer or the patient is walking in for before they walk in. So they're prepared to have an intelligent conversation and translate that into an action.
So, what do you think is your secret to success or to serve a bigger goods as a personal skills?
Whatever success I have had, that's because there are a lot of people in my team that work really, really hard, and they're a lot smarter than I am. I did think that there are a couple of things I learned very early on in my career, and I stick to those principles all the time. One is do purposeful things. I just don't do a job for a paycheck. It needs to appeal to something inside that this is the right thing to do. Uh, Second, I never had any Very early on, I learned you don't want to compare yourself to other people or compete or have an agenda or I want to climb this big career ladder. I just don't think any of those things make you happy. I think it's much better to know you're only competing with yourself. Are you doing the right things? Are you doing it to the best of your potential? And last but not least, I always believed it's at work, it's incredibly important you take care of the people you work with and good things will happen, right? So ideas are great. You come up with ideas. There are a lot of people with ideas, but you take care of the people and they'll make things come to fruition.
And Tilak, do you have mentors when you starting off to work, and what are they bring to your, overall life's journey?
I had several mentors. I think they brought different things, Milene, at different points of in my life as I grew in my career, as I matured. The biggest benefit I got from mentors uh, universally is they made me see things from different perspectives that I was blind to. I was looking at things in my own way, and they tapped on my shoulder and go, "Why don't you look at it this way, this way, this way?" That is a huge uh, uh, benefit that I got from my mentors. At Disney, I had a mentor, Meg Crofton, who I absolutely adored. I came out of a meeting. I was very frustrated. I felt some of the people in that meeting were not being honest. That I felt that they're not rowing to the same purpose, same goal that we are all needing to be rowing towards. So I called Meg and I complained vigorously that, XYZ is not being honest. XYZ is not showing integrity. They have their own agenda. And she patiently listened to me about 15 minutes. And then she said, Tilak, you are not working in a monastery and you are not working with monks. People are people. They always have, of course, they'll have their own view, their own agenda, etc. As a leader, your responsibility is to understand what is motivating them to take a particular stance or what is their point of view and bring them along to where you want to go. Just complaining about everybody is not Dalai Lama or Gandhi is not particularly helpful because they're not, right? Now, I knew that, but somebody just point blank saying that to me it gave me, I need to think about my approach on how I bring people along.
And what is the culture or principles of CVS?
We care. If you don't care, don't be in healthcare. There are much easier ways to make a living, right? So that has to be a fundamental value that everybody that works in healthcare holds dear, that I care. I care to help somebody to be healthy. And that's a big value for us at CVS.
And what is your personal routine like for your own health?
I work out, which I'm not doing as well as I should because I'm traveling a lot, but need to figure out a routine. But equally important, that is not sufficient. Equally important is you have to engage in your own health.
Yes.
Demand testing. If you have any doubt at all, get yourself tested. Ask questions. The AI chat in Health 100, when we launch it, you can ask, "Hey, I'm gonna go see my cardiologist. What are all the questions I should ask?" It will give you what you should ask. You should ask. Understand why you are taking what drugs and what the side effects are and what you should do to counter those side effects. Engage in your own health. That's how you will get longevity. Just doing good things in life is not sufficient. but engaging in health very proactively is very, very important.
So what will be the test we need to take in general that at least give us a good understanding of something we might missing out in our day-to-day life?
Do simple things, right? It doesn't have to be go get yourself tested for cancer in the blood, right? But you should know what your cholesterol is. You should know what your blood pressure is. You should know if your heart is beating properly or not. These are basic things that as long as you know if you are going in the right direction or not. So that's what I meant by just engage in your health in a basic way. I think that sets you up really well.
Yeah. And do you have a daily habits that you do as a routine you believe that contribute for your good health?
Look, I think the best way I could describe is moderation. I never deny myself if there is a nice dessert to eat. I absolutely will eat the dessert, but I probably won't eat all of it, right? I don't eat red meat. I'm a big believer in the Mediterranean diet. I think it's well proven that diet is. So I try to eat Mediterranean diet to the extent I can, even when I'm traveling. I do avoid the highly processed foods. That is something I've been very disciplined about. Um, and then there are simple things. Look, a lot of us are work from home many days. It's very easy when you're working from home to sit, plop yourself in front of the computer at 7 o'clock in the morning and not getting up until 4 in the afternoon. So one thing I do is some of the phone calls or meetings I take while I'm walking around in the house. I walk around in the house, I go up and down the stairs while I'm talking on the phone. Nobody needs to know, but that gets me moving, and that's proven to have significant health benefits.
In the terms of software and hardware, how do you think we can upgrade or improving our humanware from the health or mindset perspective?
Technology makes engaging in your own health a lot easier, so take advantage of it, right? So there are wearables that you can test your blood sugar levels. There is a wearable that, not a wearable, there is a small device that's publicly available now that you can check your heart rate, how your heart is beating, and do you have any arrhythmia. Uh, but that combination suddenly makes it easier for you to listen to your body, because body is very good at telling you what is working, what is not working. And technology now makes it easier to listen to your body. So take the time to listen to your body.
Well, thank you for all the beautiful sharing, Tilak.
Yeah, thanks for having me.
Thank you for watching this new episode of Humanware Project. So that we can bring out more amazing content like this one to you, please like and subscribe. Your support means the world to us.